Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73620, radiologic examination foot, 2 views. X-ray showing at least 2 views of the foot. 73630, radiologic examination foot, complete, minimum of 3 views. X-ray showing at least 3 views of the foot. These codes are view-dependent, meaning the number of radiographic views performed determines CPT selection. No specific views are mandated, but the count is critical for accurate coding. These views are used to evaluate the tarsals, metatarsals, and phalanges of the foot. Grouped by clinical focus, standard non-weight-bearing views, AP view, medial oblique view, lateral view, weight-bearing views, AP view, weight-bearing, oblique view, weight-bearing, lateral view, weight-bearing, specialty view, medial oblique talus, canal view, used to evaluate the talar dome. Each view offers information on bony alignment, fracture fragments, joint space changes, and the presence of foreign bodies or degenerative disease. Report example, header, AP and lateral views of the bilateral feet. History, post-op comparison, 1/5, 2023. Findings. Previously noted percutaneous Kirschner wires traversing the first ray osteotomies have been removed bilaterally. Continued interval healing is noted without acute complication. Congenital bodies of both feet previously characterized on MRI were again noted without change. Impression, interval removal of percutaneous pin fixation with continued interval healing of the osteotomies. Let's look at the views. AP and lateral views of both feet were taken. That's 2 views per foot, totaling 4 views. Each foot is coded separately using 73620 right and 73620 left. Why we do not use modifier 50. Modifier 50, bilateral procedure, is not typically applied to diagnostic radiology reports. In radiology report coding, each side is reported separately using RT right and LT left modifiers. This aligns with NCCI guidelines and ensures that both exams are billed and reimbursed as distinct diagnostic procedures. Report findings state, this is a post-op follow-up exam to evaluate osteotomy healing in both feet following prior surgical fixation. The most appropriate ICD-10-CM codes are Z47.89, encounter for other orthopedic aftercare. This code indicates ongoing orthopedic follow-up, and Z98.1, arthrodesis status. This code indicates the Kirschner wires have been removed. These codes work for both CPT codes. Correct codes, bilateral foot imaging CPT codes 73620 RT, right, radiologic examination foot, 2 views, and 73620 LT left, radiologic examination foot, 2 views. ICD-10 codes Z47.89, encounter for other orthopedic aftercare, and Z98.1, arthrodesis status. Report example, header, AP, lateral, and oblique views of the left foot. History, left foot X-ray needed same day, HX of ganglion cyst. Comparison, MRI 12/27/2022, radiographs 11/11/2022. Findings, diffuse soft tissue prominence throughout the foot. No acute fracture or dislocation, similar scattered degenerative changes. Plantar calcaneal spur, distal leg soft tissue calcifications. Impression, no new osseous abnormality. Soft tissue findings are better evaluated by MRI. Let's look at the views, AP, lateral, and oblique. That's a total of 3 views. This qualifies for CPT code 73630, radiologic examination foot, complete, minimum of 3 views left. Report findings state, evaluation of the left foot due to a history of a ganglion cyst. Imaging shows diffuse soft tissue prominence. However, the cyst is not visualized and the calcaneal spur is incidental. The most appropriate ICD-10-CM code is M79.89, other specified soft tissue disorders, not elsewhere classified. This describes non-specific soft tissue changes. A ganglion cyst is a historical entity and no acute findings are reported. The diagnosis reflects the documented clinical concern and the radiologic observation. Incidental findings like a calcaneal spur are not coded unless they are clinically addressed per ICD-10 and NCCI standards. Correct code for this report include CPT code 73630, left radiologic examination, foot, complete, minimum of 3 views, and ICD-10 code M79.89, other specified soft tissue disorders not elsewhere classified. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.